Okay, next we're going to talk about neurocognitive disorders. So the types of neurocognitive disorders or NCDs would be delirium, dementia, Alzheimer's and other NCDs, frontal temporal lobe disease, Lewy bodies, vascular dementia, and traumatic brain injury or TBI. Some characteristics of delirium is that it has a rapid onset, it's secondary to physical assault, it's irreversible with treatment, it has impaired short memory, fluctuating level of consciousness, their thought content matches loss of consciousness or LOC, they may have slurred speech, visual or tactile hallucinations, be anxious, fearful, or bewildered. So delirium is a serious change in mental abilities. It results in confused thinking and a lack of awareness of someone's surroundings. The disorder usually comes on fast within hours or a few days. Delirium can often be traced to one or more factors. Some factors may include a severe or long illness or an imbalance in the body, such as low sodium. The disorder also may be caused by certain medicines, infections, surgery, or alcohol or drug use or withdrawal. Symptoms of delirium are sometimes confused with symptoms of dementia, and healthcare providers may rely on input from the family members or the caregivers to diagnose this disorder. I'll give you a second to read this case study about Mr. Sims. So now we'll talk about the symptoms that Mr. Sims is demonstrating. He has confusion, his speech is slurred, and he is scared and bewildered. And the onset of these symptoms was rapid. So now we'll talk about characteristics of dementia. So dementia describes a group of symptoms affecting the memory, the thinking, and the social abilities. So the symptoms interfere with a person's daily life, and dementia isn't one specific disease, it's several diseases that causes dementia. The memory loss is an early symptom, but having memory loss alone doesn't mean you have dementia because the memory loss can have different causes. Alzheimer's disease is the most common cause of dementia in older adults, but there are other causes as well. Depending on the cause, some dementia symptoms might be reversible. So the characteristics include insidious onset, slow progressive development. It's usually a primary disorder, but might be related to other illnesses. They'll have impaired short-term memory. Their long-term memory slowly fails. Their level of consciousness is unchanged. Their thought content is normal initially, but later they can be confused. They have eventual loss of ability to abstract, misidentification or delusions, and affect alterations. So there's stages to Alzheimer's disease. Mild would include decreased short-term memory, difficulty finding words, decreased decision-making, concentration, and reasoning or judgment, difficult performing usual activities. They can experience denial, they get lost, and they ask repetitive questions. In moderate stages of Alzheimer's disease, they'll have apraxia, agnosia, aphasia, and poor comprehension. They can appear disoriented. They can have a blunt affect. They misidentify. They have disturbance in their sleep patterns. They can experience delusions. And they need help with activities of daily living and supervisions with their meals. They could have emotional lability. They wander, and they can have urinary incontinence. And then finally, severe Alzheimer's disease, they'll have disturbances in their gait, They'll be unable to feed themselves. They'll experience urinary and bowel incontinence. They may be bedridden. They have difficulty in swallowing, and they'll require 24-hour supervision. I'll give you a second to ask, to read this question. And the correct answer is aphasia. So we'll talk about the 4 A's. So we have agnosia, which is loss of comprehension of auditory, visual, or other senses, which is the inability to recognize something. They'll have aphasia, which can be expressive, so they have the loss of comprehension of auditory or visual or other senses, or receptive, which is the inability to comprehend what is being said or written. Amnesia, which would be their memory impairment, or apraxia, which is the loss of the ability to carry out purposeful and complex movements and to use familiar objects. Classic behaviors, again, are memory loss, difficulty finding words, difficulty concentrating, misinterpreting their environment, or sometimes hallucinations, delusions, and thinking a deceased person is still alive. They also could have pathological jealousy. They'll steal odd things. They'll have illusions, somatic preoccupation, misidentification, sundowning, which means they get worse in the evening, and loss of ability to care for oneself. So now we'll talk about vascular neurocognitive disorders. So that could be frontotemporal neurocognitive disorder, which would be personality and behavior. Neurocognitive disorders due to Parkinson's disease. Neurocognitive disorder with Lewy bodies, which would be abnormal aggregations of protein inside the nerve cells. Or neurocognitive disorder due to traumatic brain injury, or TBI. There's also neurocognitive disorders due to prion disease, which is the misfolded proteins and neuronal loss. There's also neurocognitive disorder due to HIV infection, alcohol-induced neurocognitive disorders, and neurocognitive disorders due to Huntington's disease. I'll again give you a moment to read about Mrs. Matthews. So now we're going to talk about what communication techniques are needed for Mrs. Matthews. So she needs excellent nurse-patient communication, both verbal and nonverbal. So you don't want to use sarcasm, jokes, or metaphors because they cannot understand this form of communication. You want to use short sentences and give directions that are one step at a time. You don't want to finish the sentences for the patient. You want to give them time to finish their thoughts. You want to approach the patient from the front. And it's also confusing for the patient if there's a lot of chatter because the patient cannot track multiple conversations around them. So some nursing interventions considerations would be communication, scheduling, nutrition, toileting, wandering, and memory aids. I'll give you a second to read the next response question. And the correct response is A. Patients with Alzheimer's disease can have difficulty swallowing, so you always want to assess any swallowing difficulties they may have. So now we'll talk about the psychopharmacology of Alzheimer's disease. For mild to moderate cases, you want to treat with acetylcholinesterase inhibitors, which would be Cognix, Aricept, Exelon, or Razidin, or Namenda. So these inhibitors, these acetylcholinesterase inhibitors are medications that block the breakdown of acetylcholine, a neurotransmitter crucial for memory and learning, and are primarily used to treat Alzheimer's disease and other cognitive disorders. Some milieu management would be you want to observe the patient's preference for temperature and lighting, reduce noxious sounds. When they watch TV, you want it to be purposeful viewing only. You want to match personalities of roommates when possible. And you want to provide memory aids like calendars or notes, illustrated directions, large print directions, and pillboxes. I'll give you another second to read on about Mr. Sims. And which best describes Mr. Sims' inability to carry out the task of setting out the donuts? The correct answer is D, apraxia. Apraxia is the inability to carry out motor activities and tasks despite the inact motor function. Complex instructions are particularly frustrating for these individuals. And how would you advise Mr. Sims's daughter to help him carry out tasks in the future? The answer is C, simplify tasks for the patients with apraxia. Complex instructions are particularly frustrating, so you want to give step-by-step instructions and time for response.